Hello and welcome to the insulin injection technique topic in the clinical skills of primary care. By the end of this session, you should be able to explain to patients on the method of preparing an insulin pen, explain to patients on the correct insulin injection technique. You should be able to identify the sites for insulin injection, explain to patients on the storage of insulin at home, and explain to patients on the side effects of insulin injection. Let's get started. So, diabetes is a disease in which the body does not produce enough insulin or is unable to use the insulin properly, and that's seen in type 2 diabetes. Insulin is a hormone made by our pancreas that allows our body to use sugar from the food that we consume. Insulin helps keep our body blood sugar level from getting too high or too low. Hence, for diabetic patients, insulin injection is needed to help control the sugar to avoid hyperglycemia. Therefore, the correct insulin technique is very important to make sure patients receive optimal response from the insulin. This is an overview of the steps that's required prior to preparing for the insulin injection, as well as injecting the insulin in the end. So first of all, you gather the supplies, ensure that your hands are clean, roll the insulin bottle, and draw the correct dose, inject the site of the area that's required, and finally discard the syringe and needle. This is a type of insulin preparation where commonly nurses in the wards or in healthcare settings would provide the insulin preparation. However, these days insulin comes in the pre-prepared insulin pens where the patients can use it directly from the pen itself. So if we are intending to prepare the pen, pull off the pen cap and unscrew the pen. If the rod is sticking out, push it all the way back in. Insert the insulin cartridge into the cartridge holder where there will be a color-coded cap that would be coming at the end first. Screw the pen back together and twist it until you feel or hear a click. If the cartridge contains an insulin suspension, which is a cloudy form of insulin, you must always mix or resuspend it evenly before use. If the cartridge contains a cloudy insulin, this could be Mixtard, Insulatard, Insuman Basal, Insuman Combination 30, and you must always mix it evenly before each use. To mix, gently roll the pen between your palms 10 times or move the pen up and down 10 times between the two positions shown. Now, this is what we call priming the insulin or checking the insulin flow. Before injection, always attach a new needle. Remove both the outer and inner needle caps and dispose of the inner needle cap. Keep the outer needle cap to remove the needle from the pen after injection. Pull out the dose button. Turn the dose button to select 2 units. Keep the pen upright and tap the cartridge holder gently to raise any air bubbles. Press the dose button all the way in until it clicks and the dial returns to 0. If insulin does not appear at the tip of the needle, repeat steps 4 to 6 until a drop of insulin appears. Setting your dose. Pull out the dose button and turn the dial until the white indicator line is level with the required number of units you need to inject. Adjust the dose by dialing up or down if necessary. No insulin will be released until the dose button is pressed. Injecting your dose. Push the pen gently into your skin, then press the dose button until you feel or hear a click and the dose indicator lines up with 0. Leave the needle under the skin for at least 10 seconds and then slowly pull the pen out. After you have withdrawn the needle from your skin, put the outer needle cap back on, then remove and dispose of the needle safely. Replace the pen cap after use. Now, reusing needles. Reuse of needles can lead to lipohypertrophy, which appears as hard lumps at the injection sites. These lumps can affect the way insulin is absorbed, making it more difficult to keep your blood glucose on target. Reusing of needles also increases the risk of infection, and it is recommended needles are used only once. There are four main sites of injections, which are the abdomen, thighs, buttocks, and arms. The insulin is absorbed at different rates depending on where you inject them. So the fastest would be at the abdomen, followed by the arms, and then the legs, and finally the buttocks. A simple tip is recommending the use over the abdomen as insulin is absorbed more consistently there. Choose a slightly new location for each injection to avoid developing hard lumps. For example, if all injections are given in the abdomen, note where the last injection site was and move the next one about an inch to one side or another. Continue to move the injection site until all available sites are covered. Now let's talk about insulin storage. Unused insulin stock must be kept in the fridge, not the freezer. The insulin pen with the currently in use cartridge should be kept at room temperature. Any insulin that is not kept in the fridge will expire after 1 month. Insulin pens should not be left in the car or under direct sunlight, and never leave the needle with the insulin pen. Insulin can cause hypoglycemia. So hypoglycemia is defined as blood glucose of less than 4. The symptoms include palpitations, tremor, anxiety, cold sweat, and hunger. Hypoglycemia can happen if there's missed or too little meals after insulin injection, too much exercise, the insulin dose is too high, or if there are any kidney problems. If hypoglycemia happens, take some sugary snacks, for example, a tablespoon of honey, or you may take a 3/4 cup of juice, or 3 teaspoons of table sugar, or any simple sugar substance from fluids or food that's available in the wards or the clinic. And always remember to bring along some sugary snacks with you in case you develop any hypoglycemia symptoms. Here are some useful tips. Patients can numb their skin with an ice cube for a couple of minutes before swabbing it with alcohol. When using an alcohol swab, wait for the alcohol to dry before injecting as it may sting less. And finally, avoid injecting in the roots of body hair. So in summary, insulin injection is needed to help control the sugar to avoid hyperglycemia. Therefore, the correct insulin technique is very important to make sure patients receive optimal response from the insulin. Always ensure to advise on the correct insulin injection technique and address all of the patient's concerns. We have come to the end of this session. Thank you for your time.